Hey everyone, my name is John McCullough, and I'm excited to share with you my research proposal on the effectiveness of a portion control-based weight loss program on Caucasian and African American men with obesity and low socioeconomic status. From 2017 and 2018, the prevalence of obesity was 42.4% in the US. 42.4 is an increase from the 30.5% in almost 20 years, and the estimated annual medical cost of obesity was almost $150 billion in 2008. In adults, the prevalence of obesity hovers around 40 to 45% for ages 20 and older. Metabolic syndrome has increased from 25.6% to 33.4% in 18 years. It is reasonable to assume that as the obesity rates increase, the risk factors for metabolic syndrome will follow suit. Studies document the importance of dynamic, cumulative measures of socioeconomic status in driving age trajectories of racial health inequities across multiple outcomes. As will be discussed later, the amount of information on this subject is very limited. One thing we do know is that the role of socioeconomic status in Caucasian and African American health gaps has been largely underestimated. A portion-controlled diet is about as good as receiving standard nutritional advice. This is due to participants maintaining their portion control behaviors over an extended period of time. That being said, initially, like many diets, the largest amount of weight loss occurs in the beginning of the weight loss program. In one study, after a year of this diet, while keeping in mind low efficacy, measured weight loss averaged 6% of baseline weight. All of that being said, the research question is there a difference in the effectiveness of a portion control-based weight loss program on improving risk factors of metabolic syndrome in adult African American men with obesity and low socioeconomic status compared to Caucasian men matched for obesity and socioeconomic status? So what information is already present on this subject? As earlier stated, there is a limited amount of information that is available for this specific research question. However, there is a vast amount of literature on obesity, metabolic syndrome, low socioeconomic status, and race and ethnicity to help inform this research proposal and validate its importance. Metabolic syndrome is a cluster of cardiometabolic risk factors associated with increased risk of multiple chronic diseases, including cancer, cardiovascular disease. While research into this condition as we know it started in the 1940s by Jean Vague, the description of metabolic syndrome by scientists began around 1916. In 2006, Christos Pitsvavos, Demosthenes Panagiotos, and Christodoulos Stephanadis found that it was lifestyle changes such as dieting and exercise that reduced the prevalence of metabolic syndrome. They also found that diets do not need to be restrictive if energy intake did not exceed caloric expenditure. This is one example of how proportion control could be considered a key in reducing metabolic syndrome. The other key factor that needs to be considered is the possible differences in Caucasian and African American risk factors. While there has been some progress, African Americans in the U.S. are still more likely than Caucasians to experience death and disease. This is typically linked with socioeconomic status, but the current research available does not consider risk factors when both populations have the same socioeconomic status and disease. So where does this leave us? In a nutshell, we will have to tackle this research head-on and make a different approach. This can happen by comparing two identical populations with the only difference being race. Instead of assuming it is low socioeconomic status that is the cause of increasing risk factors, approach the study design from a racial standpoint. In order to achieve significant results, 325 participants are necessary for actual power of 0.95. For the sake of this study, 400 will be needed in order to divide them evenly into two groups. Participants will be divided into two groups, a control group, where no intervention will be implemented, and the test group, where a portion-controlled weight loss strategy would be implemented. The participants in the test group and control group will be split evenly between Caucasian and African American males. Weight Watchers will be used for this study and for the study design, as it encourages portion control and balance in macronutrients. Individuals who are recruited will receive 3 months of Weight Watchers paid for by the study. Participants in the control group will receive their membership upon completion of the study. For the inclusion criteria, we will look for adults aged 20 to 50 that live in the United States and have a low socioeconomic status with a diagnosis of prediabetes and a BMI of 30 to 40. For this study, low socioeconomic status will look at single adults with an income of $25,000 or less. Informed consent must be required as the participants will be considered vulnerable due to being economically disadvantaged and possibly because of their health condition. And while metabolic syndrome has 5 components, I have chosen to evaluate fasting glucose as a representation because of this being part of the criteria to diagnose type 2 diabetes mellitus. However, for future research, that could look at other components of metabolic syndrome as well. One confounding variable that would need to be addressed would be the amount of exercise each participant does per week as it affects fasting blood sugar. In order to remain consistent, each participant will be asked to not exercise for the duration of the study. For the analysis, the first step we will do is calculate the change in fasting blood sugar before and after the 12-week trial for all participants. We will take the change and divide by the pretest for each individual and multiply by 100 to calculate the percent change after the 12-week trial. We will then record for each group, Caucasian control, African American control, Caucasian test and African American test, how many individuals had a 10% positive improvement in their fasting blood sugar and evaluate in their specific chi-square analysis. We will use this data to calculate statistical analysis using chi-square tests for differences. First, looking at the association between the Weight Watchers diet for 12 weeks on fasting blood sugar with a specific threshold of a 10% improvement in fasting blood sugar in Caucasians, and then looking at the same for African Americans in comparison to control. The secondary analysis will compare the test groups for Caucasians with the test groups for African Americans and the number meeting the 10% improvement. Previous estimations have accounted for low socioeconomic status as the etiology behind increased levels of obesity and diabetes among African American populations. This study will look to evaluate more specifically if race plays a role in the statistics. Hopefully, with this information, it can help guide further approaches for primary care providers when treating for metabolic syndrome, or more specifically for the study of prediabetes and diabetes. A limitation would be the confounding variable, as it would be challenging to police participants' lifestyle choices, making sure that the control group is not implementing any dietary changes. Similarly, making sure that there is compliance with the Weight Watchers test groups. In addition, this research only accounts for one component of metabolic syndrome, but future research, as stated before, can evaluate for the other components, but it could use this study design as a future framework. Here are all the references used for this presentation. I hope you enjoyed it, and if you have any questions, feel free to reach out anytime. Thanks.